Classification of pelvic injuries. Pelvic injuries are classified into three categories: type A, type B and type C. Type A are stable injuries. They are further subdivided into A1 and A2. A1 includes the fracture that not involve the ring, like the avulsion injuries or the iliac wing fractures. A2 are the stable injuries or minimally displaced fractures of the ring. Now, when we talk about the type B injuries are rotationally unstable injuries, but they are vertically stable. They are subdivided into three types: B1, B2 and B3. B1 is an open book injury because of the external rotation. B2 are due to the lateral compression, ipsilateral side, and B3 also the lateral compression, and that will lead to the bucket handle injury. Now type C are both the rotationally and vertically unstable injuries. They are further subdivided into C1, C2, C3. C1 unilateral injuries, C2 bilateral injuries and C3 associated with the acetabular fracture. Now here are the type A injuries which are stable in nature. In this type of injury, the pelvic ring is stable and displacement is insignificant. Here there is a fracture of the iliac wing and the pubic rami. In this case, fracture of the pelvis not involving the ring, and this ring here depicting the stability of the ring. So here the ring is intact and stable. There is a fracture only of the iliac wing and the pubic rami. A2, this is an stable injury. There is a minimally displaced fracture of the ring. Overall stability of the ring is maintained as depicting here. Now type 2. These are rotationally unstable and vertically stable injuries. So pelvis is unstable here, although there is no vertical displacement. External rotation forces usually act on the hemipelvis. As you can see here in B1, open book, it is a unilateral one. Here there is an injury only to half of the pelvis, because of which there is an opening at the region of the pubic symphysis. And see the ring here, there is an opening in the region of ring also. So this occurred due to the external rotation of the hemipelvis. Now in B1, open book bilateral type, here there is an external rotation on both the sides. It is a bilateral injury, so both the sides sacroiliac joint are affected. Along with that, there is an injury in the region of the pubic symphysis, and the gap is more compared to the B1 unilateral side. See the opening here or in the ring, it is more compared to this side of ring. Now B2 are the lateral compression injuries. This is lateral compression, ipsilateral side. Now see the ring here, how much disruption is there. There is a SI joint involved and the pubic symphysis region. So there is a rotational instability. Now in B3, again there is a lateral compression injury, but it is contralateral side, opposite sides are involved. So here the SI joint, there is no involvement of the pubic symphysis as such, but the other structures near to it are affected, giving it a look of a bucket handle. Now see the ring here, it's giving a look of a bucket handle. That's why this condition, this injury is known as the bucket handle type injury. Now type C injuries. These are the most unstable injuries, the essential feature being vertical instability. So these are rotationally as well as vertically unstable injuries. Now as you can see here in C1, they are rotationally and vertically unstable. See how much vertical displacement is here along with rotational one. So it is depicting here also in the ring that half of the ring is moving up, vertically unstable as well as rotationally. Now in C2, because bilaterally the changes are occurring, both the pelvis are being displaced from its position. So overall stability of the ring is maintained here because the changes are occurring on both the sides. In C3, there is a vertical and rotational instability along with the associated acetabular fracture. So you can see here the ring is disrupted. There is a vertical and rotational displacement along with this fracture in the acetabular region. Now let's discuss them in detail. Type A injury, isolated fractures. As we have already discussed that in type A injury, the pelvic ring is stable and displacement is insignificant. So ischiopubic rami fracture is a very common example of this type of injury. One or both the rami may be fractured on one or both the sides. So one or both the rami may be fractured and they may be fractured on both the sides. Is bilateral on both the sides. That condition is known as the straddle fracture. Minimal displacement occur. There may be associated injury to the urethra or bladder. So we should look for the sign of the urethra or the bladder injury. Patient with multiple injuries may not have any complaint referring to this fracture, and it is usually detected by the routine pelvic compression test. So in case of multiple injuries, always perform the pelvic compression test. It is only when we perform the pelvic compression test that we detect this kind of fracture. Radiologically, we should carefully rule out any associated fracture, especially in the posterior half of the pelvis, because if there is an injury in the anterior half of the pelvis, it might result into the injury in the posterior half of the pelvis. So always look carefully. It is only when this is done, when we carefully rule out the X-ray and see for the anterior and the posterior half injuries of the pelvic ring, then only we can make our diagnosis or confirm our diagnosis that this is an isolated pubic rami fracture. Now comes the treatment. These fractures usually unite easily. Union is successful and they pose no problem. Bed rest should be done for 1 to 3 weeks and treatment for the relief of pain should be done. Iliac wing fracture. This is relatively an uncommon fracture. As you can see here, it is an isolated iliac wing fracture. It usually results from the direct injury to the wing, and as we have already discussed that these fractures are encountered during the road traffic accident. So directly if something hit in the region of the iliac wing, it will result in the iliac wing fracture. Sometimes patient lose too much blood from the vascular iliac wing that it results into hypovolemic shock. Otherwise, this fracture is not associated with any complications and unite easily within 4 to 6 weeks only with rest. Now, avulsion fractures of the anterior inferior iliac spine. As we all know, the straight head of the rectus femoris muscles take its origin from the anterior inferior iliac spine. Now, these are the anterior inferior iliac spine on both the sides. And this is the rectus femoris muscle which takes its origin from this point. Sometimes due to the violent contraction of this rectus femoris muscles, which is especially occur during the jumping or fast running, there is a strong contraction, and this contraction pulls off the anterior inferior iliac spine along with it. As you can see here, a strong contraction of the muscles sometimes chips off the anterior inferior iliac spine along with it. So fracture unites easily, quickly within 3 to 4 weeks without any complication. Acetabular fractures. These fractures are usually undisplaced or sometimes displaced minimally. They usually unite without any complication, but there are chances of secondary osteoarthritis in some cases because of the damage to the articular structures following injury. Type B and type C injuries. Now these are rotationally unstable and vertically stable injuries, type B, and type C are rotationally and vertically unstable injuries. These are uncommon but important injuries because these injuries are associated with complications. And in these injuries, you will often see that there is a disruption of the pubic symphysis. Road traffic accidents are the commonest cause. And if we see the pathology, then a portion of the pelvic ring is broken and there must be a fracture or dislocation in another portion of the ring. As you can see here in the diagram, there is a displacement and rotation and moreover disruption of the pubic symphysis. Other than that, the structures like the ligaments and the structures that provide the stability, the ligaments also get injured. Displacements. Displacement is slight and it depends upon the forces causing the fracture. Different type of displacements can occur. Here is the list of the displacements that can occur, mainly 4 type. External rotation of the hemipelvis, the open book type. Internal rotation of the hemipelvis. Rotation superiorly, which is the bucket handle type, and vertical displacement. Now the external rotation of the hemipelvis, the open book type. Here the pelvic ring is opened from the front like a book, and there may be disruption of the pubic symphysis or the rami fracture in the front, and there might be injury to the sacroiliac joint behind. As you can see here also in the image, due to the external rotation there is damage to the SI joint and the disruption of the pubic symphysis. Now here in X-ray also, due to the external rotation there is a damage to the SI joint and the disruption of the pubic symphysis. Next is the internal rotation of the hemipelvis. Internal rotation of the hemipelvis usually results from the lateral compression forces. They may overlap interiorly with or without the posterior lesion. This shortens the diameter across the pelvis. There is a little risk of vascular or the ligamentous injuries. There is a decreased volume of the pelvis in this type of injury. As you can see here in the X-ray also, there is an internal rotation of the hemipelvis, and this occurs due to the lateral injuries. It may be unilateral or bilateral. Rotation superiorly, bucket handle type. Here the hemipelvis rotates superiorly. As you can see here, there is a fracture in the sacrum as well as in the region of the pubic region. There is a fracture throughout in the horizontal axis, and there is a complete superior rotation of the hemipelvis. Here is an X-ray depicting the same. Vertical displacements. This results from the vertical forces causing upward displacement of the half of the pelvis. Now here half of the pelvis is moving upward. So there is an injury in the region of the SI joint as well as the pubic symphysis. Both the X-rays are depicting the same thing. The SI joint is affected as well as there is a disruption of the pubic symphysis.